Hi and welcome. I am trying to learn medicine. Today, congenital dislocation of the hip. And after we've done it, we're gonna do wrist training. And if you participate in the wrist training on SVT owners, can be talking probably about internal anatomy, maybe even congenital problems. I don't know, I haven't read it. So, and this is no medical advice, we're just gonna read about it. I don't even know what it is. Congenital dislocation of the hip. The dislocation occurs either before or after birth. Okay, it happens before or after birth, that somehow makes sense. It is discovered at the routine examination after birth. Okay, a child after it has been born is routinely examined. And where it is discovered. In the rare cases when it is not detected early, the child will become disabled. What treatment may remedy this? Okay. So we're saying here the reason why the child should be by a doctor examined after it has been born, because it sounds as if it would be detected, it doesn't become disabled. Okay, but there's also treatment. Let's read on. Girls are affected by the disorder 6 times as often as boys. In 2/3 of all cases, only one hip is affected. Okay, women or girls have it 6 times more likely than boys or men when they are born. In 2/3 of all cases, only one hip is affected. In 2/3, only one. I think it's strange. It should be the other way around. In 2/3, one. No, it's exactly how it should be. In 2/3 is one. 1/3 both hips, both legs and hips. Okay, let's see on. Symptoms. Symptoms occur only if the abnormality has not been detected and treated at birth. Okay, if it is detected after birth and treated, there should be no abnormality. There are no symptoms until the child reaches walking age. There are no symptoms, the size it means. But the child doesn't show symptoms until it starts to walk for a few months. There are no symptoms. When walking is often delayed, so that could be one reason why walking is delayed, because there is a congenital dislocation of the hip, which was not discovered. When walking is often delayed, and when it starts, the child has a limp or waddling gait. So a limp is a limp, and the waddling gait, I don't know what it means. Some problems with walking. But it seems that the child can actually walk, so it might be even not there discovered. Does everyone know it to check for it? Because as far as we read, no, it seems like something very severe which can be easily avoided. And since when do people know about it and check for it? I've never seen a movie scene in which such an examination of dislocation of the hip is happening. No, what is even dislocated? The leg of the hip? I didn't say that. Oh, okay, whatever. Okay, causes. Dislocation of the hip can be inherited. Okay, it can be inherited. How can it be inherited? Or do they just mean it comes from birth? No. Whatever, it can be inherited. It can also be the result of a difficult birth. Okay, a difficult birth can also cause. When to consult a doctor? Immediately if the condition is suspected. So consult the doctor immediately, because then it should be the disability avoided for children. What the doctor might do: manipulate the baby's hip joints and listen for a click, which will almost certainly denote dislocation. It does work. To find that out, it seems to work. It would be interesting to know how often that had not worked. Okay, listen for a click in the hip joints is done by a doctor to find out evidence. Then refer the child to hospital for an X-ray or a second opinion. Yes, a second opinion is an interesting idea, and also for an X-ray to get a mechanical opinion. So to scan it if there's actually something wrong. If the diagnosis is confirmed and the baby is less than 6 months old, the legs are kept widely separated by a splint for 3 to 6 months. This is often the only treatment needed to make the hip develop normally. This book is from the 80s, maybe there's another treatment for it. But the treatment would be to keep the legs widely separated by a splint for a few months. And how does it work? No, I'm asking physiologically or anatomically. Because if you could understand that, why it works just to keep the legs with a splint for a few months separated to cure dislocation of the hip, maybe that would be something which everyone should know who works with anything considering with the hips. If a baby is older than 6 months, the dislocation may require a different form of treatment, perhaps an operation. Okay? Outlook: excellent if a diagnosis is made at birth or before the baby is 6 months old. Okay, if it's diagnosed at birth or very soon after birth, then however actually the treatment looks, at least with the treatment, it's called, with the treatment, healable, or whatever it's called. Treatable, healable. No, it seems to be healable. Okay, I think that we could try to make the presentation right now. Congenital dislocation of the hip. That the hip is dislocated. We didn't say what it is. I think in this case we should also mention that girls have it 6 times more often than boys. Symptoms. The first symptoms of it happen as the child starts to walk, which can be delayed because of it. The child limps or has a waddling gait. So it should be tested, the child should be examined directly after birth by listening for a click, manipulate the baby's hip joint and listen by listening to a click joint in the hips, this is all a bit complicated, how we say it, and making exercise and checking, and then actually, this is start to come. I think we have all the information together. These are just basically the information that started. I'll try it. Congenital dislocation of the hip. If it is not found directly after birth, then the first symptoms occur only when the child starts to walk, which can be delayed for it. And the child is when limping a bit or has a waddling gait. Now, directly after birth, it could be by a doctor examined, and when found that there is, by manipulating the hip joints, a clicking noise. And if it's then for an X-ray and a second opinion confirmed, then the legs of a child can be through a splint be separated for 3 to 6 months, and that should in most cases treated. If it is treated directly after birth, it should not lead to disability later on. And the first symptoms occur. Now, that's almost, it's in a way pretty easy to say, it's a problem. Congenital dislocation of the hip. If it is detected directly after birth, then the outlook is excellent and no disability develops. If it is not detected, then the first symptoms occur when the child starts to walk, which can be delayed through the congenital dislocation of the hip. The child is then also limping and has a waddling gait. Girls have it 6 times more often than boys. It can be found directly through examining the child after birth by a doctor, and then by manipulating the hip joints, a clicking can be heard, and if it is confirmed through an X-ray and a second opinion, then through a splint the legs can be kept separated for 3 to 6 months, which should be enough to treat it, so that no disability develops. And that is according to Keith Hodgkin's Family Medical Advisor, page 177, but this is no medical advice. I don't know. Let's keep it a bit. I'm going to listen to it. If it's a catastrophe, I'm going to do it again. I'm going to stop the camera. Now, and that was the medical part. If you were here for medicine, you can go directly to the next part of medicine. We will do now the wrist training. If you stay and participate in the wrist training, then it's for that, yeah, armrest, we're starting the first spotlight. Fist next. If you participate in it's for that, yeah, fist next to us and bringing them down and up. Now we're having 3 rules. The first rule is but we're stopping immediately as soon as there's pain. Next exercise, the flashlight, bring the fists to the inside, to the outside. So first rule, if there's pain, stop immediately. Second rule, go only as far as you can go with a little bit of effort. Next exercise, and flat hands, and bring the flat hands to the inside and to the outside, the magician. Now in the third rule, we just want to strengthen, not to exhaust, so don't overdo it. We have a lot of exercises. And next exercise, the pancake flipper. Bring the flat hands up and down. And on to the next exercise. I forgot what it's called. Flat hands out and up and down. And that is the T-Rex in the wall. And the next exercise, to the T-Rex in the gym. So I'm going to use the tennis ball. Press onto the tennis ball, or if you don't have a tennis ball, just make a strong fist. Release again and press again. Release and press. And switch and press again. And release and press. Release and press. Now to the next exercise, the quadrangular castle-like leg fists out and bring the fists together. Up to the outside. Down to the inside. Again down. To the outside. Up to the inside. And now the crab anxious to a fever. If you'd like to take a break, you can do it now. That exercise is perfectly correct. Bring the fist down and press a bit against it. Press on the outside. Up top. And one bottom. And now the other side. Fist. Bring your fist down to flexion and press a bit against it. Have all this all the time in code in 6 sets. And press on top. And hold bottom. And we're going on with the next exercise, the cautious big bang. Fingertips of one hand on top of fingernails of the other hand. Press a bit and open. Close again against this with resistance. And open. And close. Now switch the other hand on top. And open. And close. And the next exercise is the 4 days nurse in fierce director. Fist. And open and close. And that was it. Next exercise, I think it's time for the buckle bridge. So, flat hands next to each other, and just bend the fingers down at the knuckles. Hold it, and up again, and another time. Bend down at the knuckles of the fingers, and up again. The next exercise, if you'd like to take a break, do it again now. The frog testing the water temperature. Hands next to us, and bring the hands down with flat fingers. Up with strong fists. Down with flat fingers. Up with strong fists. Down with flat fingers. And again. And our next exercise. Arms up, the fists, bit strong fists, and bring the fists down into flexion. And bring the arms down. And again. Now turn the arms up. Down. Up. Change again. Down. No. Again. Up. Switch again. And one more time. Turn it around. Down. And up. Let's flex out. And the next exercise, the claw. Flat hands and make claws. Open again and close. Open, close. Next exercise, you can take again a break. Arms in, strong fists, and bring the fists into flexion. Arms out and into extension with the fingers. Fists in flexion with the fists, strong fists, and out flat fingers extended. And last time in and out and in. And the next exercise, the ice X. Flat hand, bend it at the knuckles and press on all 4 fingers. And out again. Other hand, bend it at the knuckles, press on all 4 fingers. And the last exercise, the launching rocket? The unfolding rocket boosters, I think was it. Long arms, strong fists, and bring his fists into flexion. And now the hands again, wrist into extension and the flat fingers. To the inside again, strong fist and outside extension. And inside. And inside. And now the last exercise, the claw. Go with moderate effort over the middle part of the arm. So here's the breaker radialis, set a bit against the arm and cut down. Over the middle part of the lower arm, over the extensor digitorum muscle. You want to relax it. And on the other side as well. And that was wrist training. I thank you very much, and until next time.